the little bit of introduction today. So the advocacy series, as I mentioned, is a new program here at the IFOPA, and we're addressing a different topic each quarter. So in this third quarter, our topic is advocating in the medical setting. And the resources that we're sharing in the 3 months of this quarter are all really focused on helping individuals with FOP and their caregivers, their support network, be active and effective participants in their healthcare team as a part of their healthcare team. So that is, really working together with whether it's your local primary care provider, the FOP medical experts that you and your care provider consult with, or one of the many specialists that I know our community members see. It's really about finding optimal solutions by supporting one another and working alongside those individuals. So our panelists here today have some amazing experiences that they are going to share that are, I think, great successes of how they've been able to do this. So I wanted to give each of them a chance to kind of just, I'm going to stop sharing now and to give them a chance to introduce themselves. So Carli, do you want to start us off?
Sure. Hi, I'm Carli Henrotay. I'm from St. Louis, Missouri, and I was diagnosed with FOP at 5.5. So right as I kind of started kindergarten. Yeah.
Thank you, Carli. Saskia, do you want to go next?
Yes, I found the correct button. Hi, I'm Saskia. I'm the mother of Yorick and Rihanna. Yorick has FOP. He was diagnosed when he was 3 years old, and he is now 17. He also has autism. He was diagnosed with autism when he was 4 years old, and the combination of both, makes everything a big challenge for us. And we live in the Netherlands.
Great, thank you, Saskia. And then Lara, last but not least.
Hi, I'm Lara. I live in the suburbs of Ottawa, Canada, with my husband and 2 boys. Our youngest, Jackson, is 12 and was diagnosed 5 days after he turned 2 years old. And when we were diagnosed, I immediately connected with the FOP community to learn all we could about FOP and how to help Jackson live his best life. So I'm happy to be here.
Great, and I'm so grateful to have the 3 of you. As I reached out to you, but you all so generously volunteered your time to be here today and to meet with me multiple times before today to kind of prepare for our time together. So thank you all so much for giving that up to help, I think, just raise more awareness about the importance of this topic. So we are going to dive in now and get started. I hope that everyone who's joining us here today realizes that while Saskia and Carli and Lara are great examples and are some experienced members of the community to share their knowledge today, that, we recognize that you may not always feel confident that starting out as an advocate in the doctor's office can be a very intimidating setting or place. And so especially in the beginning, there's kind of things that you learn as you go, and just know that it gets easier over time. But to start us off today, I would love if you can share, what were some of the most important elements of helping you all feel confident or being more comfortable advocating in the medical setting? Carli, do you want to start us off?
Sure. So my tool, I call it my medical journal. I started it back in 2016 when I started on clinical trials. I was in college, I was doing different clubs through college. I held some leadership roles. And then I was working part-time, and I also was on the clinical trials. So I just felt like I was constantly updating doctors at UPenn, my typical doctors, my parents, and my head was swimming. I had really bad brain fog, and I just couldn't keep all my information straight. They'd ask me, oh, when did this symptom start, or when did you take this medicine? I'm like, I have no idea. Last week, maybe 2 days ago, I don't know. So I started my medical journal with a bunch of different tabs where I log basically everything related to my health. I have when I take medications, when I change medications, when I change brands of medications, and then all the way down to daily symptoms, which I do daily on what hurts, what's wrong. So when I do have to communicate with the doctors, which I feel like is all the time, I can easily point and say, this is where you're going to find it. And it's just easy to keep everyone updated and in the loop, and really helps my brain fog as well.
Yeah, and having something physical and concrete like that, I'm sure just provides peace of mind that you always know, you don't have to put the pressure on yourself to recall it from memory. You have it written down and you can just know where it is and where to point it to as you point them to.
That, and I'm very anti-millennial and love having it written down and having that physical copy to show someone. Yeah, that's very anti-millennial of me, but.
Great. Well, that has certainly been an effective tool, I know, for you, and just being able to feel confident in those, or a little more comfortable in those situations. Saskia, do you want to go next and tell us a little bit about how you've gotten to that point of feeling confident in the medical, advocating with your medical professionals?
Yes. Well, first, because Yorick has both FOP and autism, we always had a big challenge going to appointments. Yorick has to be fully prepared for what will happen at an appointment and what is asked of him. And he has to be really at ease. If he gets too anxious, then things will not work out for him. Well, we know stress is another trigger for FOP, so we always make a lot of efforts to make sure he doesn't get stressed out. When Yorick was 5 years old, we have met the best example of how a doctor could be with a patient. This is what happened. Yorick broke his forearm, so we had to spend the whole day in hospital. But the next day, we had an appointment set with a doctor that Yorick had never met before, and who wanted to do a full assessment of Yorick's ability to move. Well, in short, Yorick didn't want any of it, but his doctor said, well, come and let's play some soccer. And Yorick kicked the ball, and his doctor said, now cheer. And Yorick puts his hands up, and so he did all the things the doctor needed to see what he could move. So after a few minutes, he said, well, I have everything that I need. Well, unfortunately, I don't have the picture of this appointment, but I have one of the second appointments that I would like to see. Like to let you see. Hopefully I can share my screen. Yes.
Down in the toolbar at the bottom on the black, there's that little.
Yeah, yes.
You got it.
This is the second appointment. I hope you can all see the picture.
Mm-hmm.
Because, well, they didn't play soccer this time, but they had a pillow fight, and they played hide and seek in the with the curtains. And of course, this was our doctor. But that's the example for us how an appointment with a child with difficulties can be, and that we always have to aim to find a doctor that gives us the same feeling that we had with Dr. Kaplan.
Yeah. And Saskia, you mentioned that Yorick has autism and that makes things more challenging, or that it's more important for that reason for him to have that connection. But I would say, especially for any child, when they're connecting with, when they're in the doctor's office or when they're connecting with their healthcare provider, that it's equally important for every child to feel comfortable and to feel like the doctor's speaking to them at their level and engaging them in conversations. So that certainly applies to everyone.
It does, yes.
And Lara, do you want to share a little bit about your experience?
Yeah, I mean, I think confidence comes with time and practice. And we had some challenges early before he was diagnosed that helped me find my voice, because we realized if I hadn't used my voice, they would have operated on him and we would be in a much worse position. So that helped me feel more confident that speaking up was the way to go. But today I wanted to talk about something else, a tool that's helped me advocate more effectively, and that's care maps. A care map captures all that an individual and their support system manages to provide comprehensive support in their lives. It can identify the gaps or duplication in care, your support systems, and help you see ways that you can better coordinate your care as well. It is a good way to evaluate your priorities and can be used as a tool to advocate for the life and care that you want by illustrating the scope of needs to all the medical and educational professionals in your life, as well as coworkers, your boss. It can change and grow with your life.
Great. Yeah, and so Carli has highlighted for us, one specific tool that she has used, which is her medical journal. That's something that she stays very organized with. It helps her feel prepared to go into those appointments. And Saskia has highlighted kind of the relationship that they have with their providers and how she looks for certain things and how there are, different kind of qualities that she wants the York's doctor to have. And then Lara kind of combines the two, and she brings the perspective of, she does the work, she puts in the time to create the care map, but the care map really captures their interactions with all of the different elements of their healthcare team. So it is kind of that partnership of, here are the doctors that we work closely with, here's how we all work together as a big unit to support one another. And so I think those are three really great examples of sort of the tools you've used to reach this, I don't want to say like the peak of the mountain, but that you've used to get to where you are today in your role as an advocate. But I want to step back a little bit and talk about how you got there. So I know none of you just immediately had this miraculous tool that you used and it was a flawless integration. Ultimately, leaning or learning what that resource was going to look like came from a struggle or came from a challenge. So I'd love to go through and kind of talk about how you got to where you are now and what were some of the learning moments that helped shape you or shape the tool that you created to get you to where you are today. So Lara, if you want to keep rolling with the care map, we'd love to hear more about that.
Sure. Okay. I'm just going to share my screen. Okay, can everybody see that?
Yep, we can see it.
Perfect. Okay. So I learned about care maps from a friend that I met through a Facebook group for local parents of kids with a physical disability. We both had children with ultra rare diseases and became friends through attending various rare disease events in our city. She had shared the article about where she learned about care maps and shared what a powerful tool she found it was to be advocating for her daughter. And I'm just going to digress a little here and say, I've learned so much about advocacy through networking with other parents whose children have a rare disease or a physical disability. The FOP groups on Facebook are an amazing example of the support you can receive and learning tool. But I encourage everyone to network beyond that. Your local disability networks can provide information and guidance on how to navigate transportation, schooling, funding, tax breaks, all the things specific to your area or region. So I highly recommend reaching out and seeing what else is out there, because that's how I found this tool. And so how do you make a care map? Basically, I just need to start it. There we go. You start by putting yourself in the center of the map and your immediate family. From there, you need to think about all the key domains of support and care, such as medical or health, home care, community, support, school or education, work, housing, transportation, social services, leisure, social or recreation, behavioral or development therapies, advocacy, spiritual or religious, and your friends or family. You don't have to put all these on there, but these are the categories that you want to think about when starting. It's up to you what you put on your care map. You may even want to combine some things together. Your care map can be simple, like my original care map that was scratched out on paper, or you can make it fancy with color coding and symbols. Your care map should be treated as a living document that can be modified or can be modified to reflect changes in your care and support as they evolve over the years. And the neat thing about doing this exercise is, you know, when I first sketched out this map, I mean, I've added a few things. Not all those bubbles were there initially, but when I first sketched it out and I looked at it, I was just shocked at the complexity of our lives. And, you know, I thought, geez, no wonder I feel overwhelmed so much. You know, there's just really a lot to coordinate. This is my son Jackson's current care map. At the center, we still have Jackson and the family. Jackson's 12, so the largest domains of care for him are really home, school, and medical. But you know, these domains will change over time as he gets older. We're gonna, when he moves on to university, you know, we'll probably have to add some housing stuff later in life. You know, work will replace school as the most important domain of interaction. It got really complicated. Like I don't know if you know the last one, you know, there were sort of lines everywhere. So to try and like cut down on the visual clutter, I kind of grouped in a box each domain and then didn't use lines. I just used the lines to show where the domains interacted with each other versus directly with Jackson. For example, the OCTC recreational therapist consulted with the school to help provide ideas for gym. They brought in like curling done on wheels that they could do in the gym, things like that, different ideas. So that just sort of cuts down on the clutter a bit. I use square text boxes to represent an individual, like a doctor or a therapist, and I used the rounded text boxes to represent organizations such as the IFOPA or a vendor, different things like that. And you know, really, you can be as creative as you want, right? It can be simple, it can be fancy. It's your tool, make it work for you. And then using the care map to advocate, I found it to be a great tool in advocating both in the medical and school setting. It gives the medical care providers and school staff perspective on the complexity of his life and the challenges that this brings. Adding another therapy or catching up on all the schoolwork missed due to an appointment may not seem so reasonable when you have them look at this big picture of what's really going on in his life. It also helps us as a family keep sight of our own priorities when we're having these discussions with the providers. Because I think it's very easy when living with a rare disease to get caught up in your health. And we want the focus to be on living life. Let's get out there and live life to the most. It also can open up doors to more support through programs such as the Complex Care Program at our local children's hospital. It was a program created to better support families like ours that have many medical professionals' care to coordinate. In the program, there's a pediatrician and a nurse assigned to each child. The nurse helps coordinate care to reduce trips to the hospital and improve communication between all the medical professionals. The doctor oversees the big picture of the child's medical care and health. And this program has provided us with so much support over the last few years. We have a document on file at the hospital, and we carry a physical copy with us at all times that flags the challenges and risks in treating Jackson specifically, you know, captures where his restrictions are, etc. This document alone has been pure gold. When we arrive in the ER, we're given a separate waiting area or room to reduce our virus exposure risk. The imaging technicians are far more receptive to my input on the positioning and support needed during x-rays. And if something more complicated arises, they can page the complex care doctor for assistance. The complex care team also advocates with other departments in the hospital on his behalf. And we've particularly benefited from that recently with all the delays in care with COVID. After I communicated concern early in the pandemic about how long it had been since he'd had a dental appointment, lo and behold, dental clinic calls the next week. We'd like to book you in. Similarly, recently, you know, I was complaining about multi-one-year delays in investigating an issue that everyone keeps saying, it's nothing, but let's just check. And then it's like a year to get that test and a year to see that doctor. And it's been going on for 2 years now. Well, a couple weeks later, I get a call. Oh, there's been a cancellation in the MRI. Do you want to come in? So these are the benefits of using the complex care program has provided to us. And that incredible program may never have been offered to us at all if I had not so clearly demonstrated the complexity of our lives with the care map. Not all children's hospitals have a complex care program, but it is a program that is spreading. So I encourage you to reach out to your local hospital and inquire whether that is an option for those of you with children who are here today. Care maps can also identify gaps in care or help them help you better understand what's going on medically. So I highly recommend giving a care map a try.
Thank you, Lara. And you can tell just by looking at this that there is an overwhelming amount of information that I know Lara carried around in her head, and that every, I'm sure, individual with FOP, adults and caregivers kind of feel responsible for. So I hope that if you'll notice a theme kind of maybe between what Carli shared and what Lara has shared, is that, you know, you can simplify and hopefully alleviate some of the stress on yourself by taking these measures to be organized and to be proactive and having your information kind of readily accessible for people. So thank you, Lara, for sharing that. I know a lot of hard work went into organizing that and the many iterations it's been through, but it is a work of art and it's very impressive to look at. So Saskia, do you want to follow up with that by talking a little bit more about the process of kind of working to find more of the interpersonal dynamics within that relationship? Obviously, there's a lot you can do to be prepared, but how do you kind of navigate the waters of making sure you're prepared to talk to the right person, or that your relationship with that person is as effective as possible?
Yeah, sure. Everybody that deals with FOP has to deal with a lot of doctors, but doctors with different specialisms, but also different attitudes. And we find it very important to find the doctors that are the right fit for us. So I want to tell you a bit about different kind of doctors that we met over the years. When Jorik was 2 years old, it was before he was diagnosed with FOP, there was an orthopedic surgeon that was sure he could fix Jorik's bent toes by having him wear splints. But Jorik kept crying and kicking until his legs bled all over. So we told the surgeon that we felt it wasn't the right approach, that it obviously hurt him and that he didn't want to wear them. And that we would like to consult a specialist because we thought something else was going on just besides the bent toes. But he refused, and he said Jorik had to wear the splints or he would stop all the treatments. He literally said, it's my way or the highway, and he gave us 2 minutes to decide. So we chose the highway because I learned at that moment you have to trust your instinct always. Well, after that we went back to our GP, and I literally cried my heart out, and she referred me to a wonderful pediatrician. At that point, the man had no clue what was going on, but he was willing to help me to search for the answers. It was very important because I already Googled a lot, and at that point I found the Dutch website about this ultra rare disease FOP, where all the patients had the same strange toes as Jorik had, but I didn't think that could be what Jorik was experiencing, because he never had a flare-up. But a year later, Jorik did have a flare-up on his back, a big one. And I kept a printout of this website, and we went to the same pediatrician with printout. And I expected him to have some kind of reaction like, well, this other hysterical mother who finds something on the internet. But instead he said, well, if a mother suspects something is going on, as a doctor, you better listen. And it was that kind of reaction that was, for us, made it clear that this was the kind of doctor that was the right fit for us. Because he did think Jorik might have some kind of cancer, but because of the information and the respect he had for us as parents, he did blood works instead of a biopsy, and that's well, we know today that it saved Jorik from a lot of harm because of the way he listened to us. So that was a very good experience. But after that, we also found out that sometimes it takes some time and work to find the perfect fit. Because Jorik's pediatrician, he retired, and we were transferred twice. And we ended up with a lady pediatrician who felt it was enough to take Jorik's measurements once or twice a year, because she said, well, you are in contact with doctors in America, so I really don't have to do anything else than that. She also didn't try very hard to be in contact with Jorik. She always talked to me, and well, Jorik wasn't responding, so she was like, well, just let him sit on the side and I'll deal with the mother. And every time I had some questions, she said, well, you can always ask the doctors in America because they probably know more. And it was not what I needed. What I needed was a doctor that could help me, because I know as a parent at that point, I already had a lot of knowledge about FOP. I think I knew more about FOP than she did as a doctor, but it's not only the FOP, because I just needed someone to discuss all the things that were going on in Jorik's life, other health problems he might have, that he does have. So I needed someone to talk to, and who just could help me with all the medical stuff. But because I felt at that point that she couldn't be that person for us, I told her directly, because I just could have asked the hospital for another pediatrician, but I wanted to talk to her about it. And she took the time to have an appointment to talk about it. And we had a very long talk about it, and she apologized and said, well, that I was right, and she should have tried to do more. And after that, we continued our relationship. She is still Jorik's pediatrician to the day, and it's the best pediatrician we've had so far.
Thank you, Saskia. I love that you're able to share, like, you know, without having a documentary, you capture so well kind of what your journey was like to get to that. And you highlighted how it is really a partnership. You didn't walk into that relationship with your pediatrician expecting her to be perfect and to have everything, that you were willing to stick with her and work through the challenges. And even just, you know, what you shared in your story with Jorik's diagnosis with his initial pediatrician, which was that, you know, you were the one who went online and found it and brought it to him. And even though he thought that maybe Jorik had cancer, because you had done the work and put in the time, you were able to get him diagnosed so early. So it's a beautiful portrayal of, I think, you know, the role that a patient plays in really making that relationship successful, that it's not all on the healthcare provider, but it really is a partnership. And an evolving one at that. You know, it's never stagnant, always changing, always growing, hopefully. And it's beautiful that now you can say that even though that relationship with his current pediatrician didn't start off the best, it's the best one you've ever had. And Carli is a beautiful example of putting in the work. Carli, you work so hard to track your health and to have your information organized and ready. So can you tell us a little bit more about I know you've kind of briefly highlighted it, but can you tell us a little bit more? And I know you have some beautiful slides to share about your medical journal.
Yeah, so kind of unlike Saskia, I've been really lucky. I had a really good relationship with my pediatrician from the start. He's actually the only other doctor in my area that's seen it, which saved me from being misdiagnosed. But also on that note, I was emailing him a lot because I don't have to go see him. I can tell him, hey, I have a flare up here. Should I start prednisone? Should I not? What should we do? So a lot of our contact is through writing. And then in 2016, I started the clinical trials. And then I was also updating those doctors. Let's see. But so I was constantly updating doctors, most of the time through emails. So let's see, I started the medical journal. Let's see. Like I said earlier, I just had terrible brain fog and was constantly working on updating everyone, and I couldn't even keep myself straight. So I started this journal so I could just tell everyone what's going on. The first 2 pages are emergency contacts and daily medicines. It really helps me to have this written out because every time I go to the doctor, they ask me to update my meds, and my type A brain can't see how they're seeing. So I just give it to them in a list, which makes it easier for everyone. I have a list of all my doctors in there. I had a tab for clinical visits when I was on the clinical trial, tests, so I can track blood work, blood pressure, scans, flare-ups and falls, doctor's appointments, illnesses, medicine changes, vitamin and supplement changes, periods. I also added a tab for FOP surveys to let me know when I last did those so I can update those accordingly. And here you see just a couple of the pages. I write in pencil so it can easily be changed or updated. Daily symptoms, I do everything every day. It's body parts that hurt, joints that are swollen, if my skin itches or is irritated, if something hurts, if it's at a certain time. I just track basically everything. It's so easy to go into the doctor's office. And he's like, oh, when did you last see this doctor? And I can easily flip to that page and tell them. Or daily symptoms are like, oh, how long has your leg hurt? And I'm like, I don't know. So it's easy. I hand it off to my mom at appointments. And I'm like, here, you're in charge of the binder. You can track whatever they ask. I like the 5-star notebooks because I have those pocket dividers that I can put like my insurance cards in, like appointment reminders. I use paper clips to divide the sections so I can easily flip to them. But it's just something that has always been easy for me to track things.
And Carli, I know that you shared that you will, a lot of times it gets frustrating to have to fill in forms when you're going to doctor's appointments and like writing things. So a lot of times you'll just say, here, you can photocopy this, or you'll bring photocopies yourself of some of the pages. And then instead of filling out all those forms, you just kind of slap in your photocopy and it's done.
Especially when they ask you what medications you're on. I'm like, do you have 5 years for me to explain this? So I easily just copy that in there, and they're like, oh, this is so easy to look at. I'm like, yeah, I know.
Right.
Yeah.
And obviously now I'm sure everyone saw that Carli captures a lot of information, but that was also sort of an evolution. You didn't always have, like when you started, you weren't tracking all of those things. You kind of learned, oh, this is helpful for me to record and share. And I know you said there's things that you've tracked because Carli shared that she's a very, like, she likes to know her body. So she is one of those people. Every personality is different, but I would say, Carli, you are definitely one of those people who is like an information seeker and you want the information in a readily accessible form. So
yeah, I can easily tell the doctors, oh, this medication isn't working. And they're like, how do you know? And I'm like, I don't know. I just know it's that one that I think that's the problem. And 9 times out of 10, if I stop that medication, the problem stops. So it's really helpful to me to just have all the information and kind of brain dump it into one spot.
Yeah. And again, a living, breathing document that's constantly evolving and changing.
Yeah, and I update it every year, so I have all the past years, but I also not carry around information from 5 years ago. I can easily find it if I need it, but if I do it every year, then it's kind of easy to have that binder for each year.
Great. And as Carli shared, she does make those. So if you're someone who is intimidated by the process of trying to create your own, you can reach out to her. We can share her contact information in the follow-up email, and you can learn how to either make one of your own, or she can help you get started by making one for
There's
you.
also, I'm sure you can make it like with OneNote on your computer, because a lot of people aren't physical now. I prefer to have a physical document, but there are options to where you can have it on your iPad or your phone as well.
Well, thank you, Carli and Lara and Saskia, for going in depth and sharing a little bit more about how you got to that point, or to where you are in your journey. I wanted to kind of close us off. So this is our last question, and then we'll have some time for questions that any of our attendees have. Can you all maybe talk about one unexpected benefit that's come from being an active participant in advocating in the medical setting? How have you, like, maybe not anticipated, but seen like other fruit from this labor? Saskia, do you want to start us off?
Sure. Well, I think an unexpected benefit that we became so confident in how we dealt with all the appointments that Jorik was having, and the way that was best for him. That's the things I learned over time, like not more than one appointment in a day, but was for him more than enough. That we always treat an appointment as something special, that we always like to get a special sandwich, or maybe he gets a special present. That we don't rush anything, sometimes bribe him, I must say. But that way, he always felt very confident to go to appointments. And when the opportunity came to participate in an FOP medication trial, we thought we could give it a try. We thought we have all the possibilities now for Jorik to be in such a trial, and to keep it comfortable for him. And we try to explain him the importance of participating, but also the benefits. And Jorik turned out to like flying in a plane very much, and staying over in a hotel very much. So that made it possible to go to London, where the trial was held, and that he could also be in this trial, and that we never expected that we could go to something like that with a boy who has a very big problem with autism, and was very difficult with handling a doctor's appointment at first. So we came a long way.
Yeah, and I think even like you said, with Jorik, the autism was kind of another hurdle or barrier to overcome, and being able to do all of that. But it's such a beautiful example how every child can be kind of taught that they have an active choice. Like the way that you guys included him in doctor's appointments from day one allowed him to be able to be involved in making that very important decision. And I know the clinical trial involvement can be a hard thing for a lot of parents to navigate with their children. So I think it's such a beautiful story that it went so well and so smoothly for him to make that choice because of the way you guys had always included him. So thank you, Saskia. Lara, do you want to go next?
Sure. So, I mean, I would say that becoming a better advocate has helped me build really strong relationships with all of his care providers, from everyone from his van driver to his teachers to the doctors. I had a very similar experience that Saskia had with the pediatrician. I had a similar conversation with the principal of Jackson's last school, and it totally transformed the relationship. the real benefit besides just the relationships is that through those relationships, it's opened up doors to programs and services that we may not have otherwise had access to or even heard about. I find the more that you talk to people, the more resources you learn are available. And so, we got access to the complex care program, the chronic pain team, a dietitian when he was younger. When he went through a period in a wheelchair and put on weight very quickly. Dietitian was a big help. And the recreational therapy program as well, that's opened up other activities to him that we may not have been aware of.
Yeah, it really is a team effort. So when you can have those people working together, the knowledge sharing benefit to you and also to them, obviously, just increases. Great. Thank you, Lara. And Carli, do you want to end us off by talking about how you've merged some passions?
Sure. The journal has given me a lot of confidence going into appointments, just because I felt like I was always forgetting something. So even with the journal, I go into appointments with a sticky note in the front, and check off things that I wanted to ask the doctor about. But it gives me the confidence to believe in myself because I knew I had the information I needed going into that appointment, no matter what they asked me medically. And it also gave me a reason to kind of practice my calligraphy and do different writing skills. I've always loved handwriting. So it gave me a way to merge my handwriting, my organizational skills, and just know that going into those appointments, everything I needed was in there. Or even if something were to happen that I would need to go to the ER or something, I knew my family members would be able to find the information they needed if the doctors asked them if for some reason I wasn't able to tell them. So yeah, it's just a nice school with a lot of passions.
I don't know if you all saw when Carli was going through her slides, she had one slide that had all of the headers, and each of the headers was in sort of a different style or font, or however you would, I don't know the exact term when you're doing the penmanship and calligraphy, but yeah, Carli is a talented artist as well, I would say, in that way. And so it's great to be able to kind of merge those and make, for Carli, I think you enjoy kind of tracking information about your health. But I know that for some people, it may not be quite as enjoyable. So hopefully for those people, you can find a way to, whether it's, using art on your computer, if you do OneNote, like Carli suggested, and do a digital version, or if it's the penmanship in a hard copy version, you can find ways to kind of make the different areas of your life blend together and make things more enjoyable that may not be the most fun. So great. Well, thank you to Carli and Saskia and Lara. Having the three of you together and like fully sharing your stories has been a little overwhelming for me. I feel like I'm just about to burst because I'm so happy. After each of our conversations, I've been in awe and so inspired by each of you, but to hear you share those collectively as a group it's just so incredibly inspiring. So thank you for all coming together and sharing that with the community. I did want to ask if anyone of our attendees have questions, if there's anything you'd like to learn more about the care map or the medical journal or the kind of interpersonal skills of interacting with your healthcare provider. I'll give you guys just a minute. You can put them in chat or you can just unmute and ask them yourselves. While we're doing that, I did want to share a quick preview for what is to come. So next month, I'll start with what has already come. So in the previous month, we did a podcast with Dr. Ed Shao, and Saskia kind of touched on this in her story or in her sharing her experience that, it's great to have an FOP medical expert, but that primary care provider is there and they're really your point of contact for whether it's an FOP health concern or something that is unrelated, totally unrelated to FOP, how important it is to have a primary care provider that's local. And Dr. Shao and I touched on that, as well as so many other important topics of creating an effective relationship with your healthcare provider in the podcast interview that aired last month. So if you have not already listened to that, Dr. Shao is one of the 4 FOP medical experts here in the US who works closely with the FOP community. And he is a wealth of knowledge and just a joy to chat with. So I hope if you haven't listened to that, you'll take a peek. And also while you're there, you can find it at the website, the URL at the bottom of the screen. You'll also find our workbook page. So this is something that Karen and I have been creating for every quarter of the advocacy series. So you can go in and you can start to kind of apply or put to practice some of the skills that Dr. Shao talked about, but also that Carli and Saskia and Lara touched upon in this worksheet. So I would encourage you all to, not just listen today and then leave and kind of but to create a follow-up item for yourselves, to challenge yourselves to apply what you've heard today by maybe starting with that worksheet. And then just a heads up, the next month on September 10th, so not too far away, we'll be doing the 3rd resource for this quarter, which is a resource webinar on advocating in the medical setting, where we'll be focusing more specifically on advocating in medical emergencies. So I don't know if any of you saw on Lara's care map, I know she has a medical alert kind of box or item there. That is one of the resources that they use. And that is something that I know many members of the FOP community have used. So Julie Hilton from Medical Alert will be coming, and she'll be sharing about the Medical Alert services and resources that they offer. And she'll be joined by community member Steve Eichner, who also has Medical Alert and has used that and just the benefits that he has seen to it. And then I will also be there, obviously sharing a little bit of extra information about the FOP emergency cards that we have and the personalized medical form that was created by Amanda Callie to help support the FOP community in medical emergencies. So I would encourage you all to, if you haven't registered for that yet, to sign up for it. You will be able to watch a recording of that as well. Let's see. So one question did come in. Okay, it's about the complex care team. So Lara, do you want to kind of, I know you shared that it's not at every hospital, but do you want to kind of repeat maybe a little bit about what you know about accessing complex care?
Yeah, I don't really know a lot beyond Ontario. I know there's an organization sort of that links them all. But I think if you go to your local children's hospital website and just do a search on complex care, or even just Google, I just tried it now, did a quick Google complex care, and it came up with a dozen hospitals in Ontario that were offering the program. So I would just recommend trying that. You could also, speak to your pediatrician, or if you have doctors at the local hospital that they might have connections as well.
And I would also say that complex care may be like the Canadian term for it, but there could be other similar resources that are available in different countries that kind of go under a different name. So I think, yeah, Lara's suggestion to maybe speak with your pediatrician or your primary care provider about kind of what it is you're looking for could be one good way to find that. And Lara, can you clarify, so does the complex care doctor replace your pediatrician, or is that just another kind of layer of support?
Technically, no, but to be honest, we almost never see our regular pediatrician. We do still have a pediatrician in the community. So say he did fall and injure his wrist and we were wondering if it was broken or sprained, we could just pop in quickly to see that doctor. Or if he had, a sinus infection or something that needed urgent care, but not emergency care, we would use him. But honestly, we see the complex care doctor every 4 months, and that's usually all we need. So not technically, but you might find it pretty much does replace it.
Thank you, Lara.
And Hope, can I just piggyback on that for the question of how to find out about complex care? Something else you may be able to do is most hospitals will also have a social worker. So if you can't find something on a website like Lara recommended and you're searching, or maybe it is called something different in the United States or whatever country that you are in, most hospitals will have a social worker that you could contact to help you find different types of resources or programs, just like the complex care one that Lara uses.
And Dr. Shao and I also touched on that in our podcast interview, that, you know, we kind of went through what are some really important players in the team to include. And he noted that social work is a really important resource to include in your team. And it may not be something that is offered or that you are automatically kind of paired with, but that you can always ask for social work referral to help them navigate those things. So I think especially here in the US, if you're not inpatient, a lot of times our community doesn't tend to get connected to a social worker, but it is always something that you can ask about. So thank you, Karen. All right. I just wanted to check. Yeah, so just lots of gratitude in the chat for you ladies for sharing your time with us. And I want to echo that and say that it's such a privilege for Karen and I'm sure for everyone else to continue to learn from all of you. The FOP community has so much knowledge, and the more we can kind of bring that to light and share it, the better everyone is. So thank you, ladies. And